Hello and welcome to Skincare for Hope, hashtag Hope series. One of the pillars of Skincare for Hope is educating those with sensitive skin. So we created this webinar series to bring together industry experts from all corners of the field to share their insights, perspectives, and tips on skincare and skin health. So thanks for joining us today. Our video today will be on teen skin health. So for our teens watching, learn more about changes in your skin and what you can do. So today we have my cousin, my good friend, Dr. Vanessa Ticzon. Now, she's a pediatrician, but she has a very good specialty. It's adolescent medicine. Tama ba ako, Van? No?
Yes, correct. So
Bago
good
lang
day,
to, no?
everyone.
Yeah. So what made you want adolescent medicine?
Well, at first, I really actually wanted developmental pediatrics, but when I tried to explore adolescent medicine, I realized that adolescents are actually a vulnerable group, and they are orphaned by medical treatment, and they are not a priority. That's why I was challenged to go through this path, and as you said, it's relatively new, not yet so popular in the Philippines. That's why I wanted to go through this career path.
Oo. So ako, Derma, laging pagkasama ang adolescent, laging may parent, no? Laging may mom and dad
Yes.
who would assist them through their procedures. But, they're very independent pa rin. Parang it's still, you have to give them the power to decide on what they should do for themselves, for their bodies, no? So it's important to explain to them then. So far, since we're talking about skin health, ano yung mga nakita mo ng mga skin concerns kung may mga concerns silang sinasabi sa'yo during consultation for teenagers?
Yeah, most common so far is pimples or acne, no? Usually nga, they don't go for just for that. They go for other reasons. But when you do your physical exam, you will see that they have this adolescent has pimples. And when you ask her that, are you concerned about your acne, for example, she would really say yes, no? So it becomes like a secondary reason for seeking consult, no? So acne yung common because it's readily seen, no? And you know that adolescents are very much conscious of how they look and they want to feel accepted by their peers. That's why it can be a source of stress for them pag nag-break out yung pimples nila.
Oo, may emotional concern rin talaga, no? Na they feel depressed sometimes.
Yeah. And they feel anxious.
They feel anxious. Oo. So we have some acne questions here. Actually, sa daughter ko to galing eh. Bakit nga ba nagkaka-acne and should I pop my pimples? I'm sure natanong na rin sa'yo yan.
Yeah, it's a very practical question. So during adolescence, we know that our hormones really act up, and there are more activities sa sebaceous or oil glands natin, no? So there's more secretion of the oil glands, which can cause blockage of the pores of the skin, no? Kasi aside from the oil, there's also the dead skin cells, no? So pag nag-block na yung pore na yun, plus there's a common bacteria on the skin, no? Pag nag-act up together, it can lead to inflammation, redness of the skin, and eventually lead to pimples or acne. So that's how it starts, no? Of course, you should not pop your pimples, no? Natitempt talaga tayo, no? As teenagers, no? Before then pa na putukin para finish na. But you should not because it can lead to infection. That's what we don't like.
Oo. And so, ang hormones kasi during puberty, no, during the adolescent age, are so strong. So, may tinatawag kaming T-zone. So, this is your forehead and your nose. Yeah. Usually, sa teenagers, yan ang unang maglalabasan sa T-zone area. Kasi yan din yung pinaka-oily na area.
Yes.
Those patients who complain sa'yo, parang ang oily na ng face ko. Parang, what should I do? We encounter those kinds of,
Yes, mga concerns, no? Yes, so usually they will ask ano bang ilalagay na ano ointment or cream. Usually our first message really is to wash your face, no? Wash
Yes,
your
I
face
agree.
at least 2 times a day,
Agree.
no? Upon waking up and before you sleep with a mild or gentle skin cleanser. Then pat it dry. Of course, we don't scrub our face, no? So yun lang talaga yung first messages namin. But if it's really uncontrolled, the breakout is really bad, we refer already to our derma friends,
Oo,
no?
I agree with that. No, talagang yun ang first din tinuturo ko. You have to wash morning and night with a gentle cleanser pa nga. Kasi some teenagers would want the scrubs kaagad. You know, the
Yeah.
apricot, yung may mga beads. Pero
Mm-mm.
actually, ano yun eh, abrading yun sa skin eh. Lalo siyang nasusugatan, lalong nag-overdry yung balat. So in the end, parang your skin actually wants to produce more oil. So lalo ka actually magiging oily. So
Yeah,
parang,
mag-worsen
oh,
lang,
pwede
no?
mag-worsen din. So
Mm-mm.
pwede na actually ang mild cleansers, your oatmeal soaps, basta you have to parang keep on yung washing of your hands, di ba, 20 seconds. Ganon din sa
Yeah.
face. So parang ganon din. You're doing
Okay.
it 20 seconds na para natatanggal yung debris. Hindi ka nagmamadali masyado
Okay.
na nag-wash out lang. That already helps control with oil production. May mga iba pang products pero number one talaga is to cleanse the face. Lalo na ngayon yung mask acne. 'Di ba, we're wearing, ayun ako, nakamask ka rin pala today, but
Yeah.
we're in a public place kasi. So yeah, kasi ang tagal na nakamask. All the heat is there, ganon. So ang growth ng bacteria is faster. So usually one of the
Okay.
first thing dapat nagbo-wash in between kung pwede, like midday if you're out. Although homeschool naman ating mga teenagers.
Yeah.
Majority. Okay, other than acne, ano pa yung mga parang nakikita mo na skin concerns ng
Na
teenagers?
concerns nila, some would tell about their eczema or dermatitis, especially if they were diagnosed nung kids pa sila, yung mga atopic dermatitis or skin asthma, manifesting as redness, no, and itch and drying of the skin. So parang sabi na, nag-chicken skin, sobrang scaly. So for that, we usually say na syempre wash pa rin with a gentle skin cleanser and moisturize talaga, no? Moisturize at least mga three times a day of unscented and intense moisturizer para to avoid lang yung itch and irritation.
Yes, I agree. Yung daughter ko, ganun din na. She has skin asthma. She's on puberty. So ang rashes niya is actually
Okay.
here,
In
in
between.
her, in between arms. Na every day, may rashes or wala, lalagyan niya yun ng
Apply.
moisturizer. Kasi that
Yeah.
helps minimize eh. Although stress-related din yung eczema. Parang
Agree.
highly stress-related din talaga siya. Bukod pa dun sa food factors that they say. But to prevent it, oo, tama. To have a gentle cleanser and to moisturize after. So body hygiene, I think, yun yung isang
Mm-mm.
important na to teach teenagers. May mga tamad bang teenagers na maligo? I don't
Of
know.
course. Oo, meron. Especially this pandemic. Kasi katwiran nila, they don't go out naman. So,
So
kahit na every 3 days,
you
yeah.
encounter that every day.
Yeah, that's common, especially for those with depression. Sometimes a
Mm.
week talaga, they don't take a bath. I remind them, and also the parents, no? So parang tinatamad na manifest as pati sa hygiene, ayaw.
Yeah, dapat bathing, it could be parang it can help decrease the depression. I think that's parang
Mm-mm,
it brings you to a state na you feel clean and refreshed
yeah,
suddenly.
agree.
So somehow your depressive state medyo parang maglilift siya
Yes.
somehow. Oo nga. Oh my. Have to check on my my kids na naliligo. Kasi they'll be on the internet the entire day. Then suddenly they remember at the end of the day, ay, hindi pa ako
Hindi
naliligo.
pa pala. Hindi kasi required maligo at maligo before going to class,
Before
diba?
going to class kasi online, no?
Online.
To see them and smell them. But yeah, no, as a teenager who's growing and hormones are so strong, sweat is mas madami. Your glands are stronger. So your tinatawag naming apocrine glands parang mas malakas, so the body odor also appears, no, during this time. Kaya hygiene, a daily hygiene, even if it's online class, I think is very important. Kasi it's something that you'll be carrying for the rest of your life, di ba?
Yes,
So,
it's a part of a routine talaga siya.
Bata ka pa lang, you have to start doing it on a good hygiene habit. Okay. Oh, well, speaking of perspiration and body odor, may mga nagtatanong ba sa'yo regarding that?
Actually, not so much. Pero of course, it's one of the common concerns also. No? Maybe because our teenagers are also aware na that there are different products naman that they can use, the deodorants and antiperspirants to control their sweat.
Yeah, there's a lot naman in the market over the counter. And then I read then sa derma, if you're a strong perspiring person, no, there's that antiperspirant or the aluminum chloride or your tawas is actually best applied at night.
At night, okay.
Just to parang let it absorb pa some more. Kasi yun yung panahon na hindi ka nagpapawis sa gabi. Pero if malakas ka pa rin talaga, you can still put a deodorant in the morning. If that's one of your concerns or problems. Ang dami kasi nangyayari talaga as you grow up, no, so many body changes. And ang one pa is hair growth.
Yeah, so it needs shaving, no? So a common concern is how frequent should they shave? There's no hard and fast rule for that. So they said nga na it depends on your genetics. If yung parents mo medyo hairy, so baka you have to do shaving more frequently. The darker hair first that comes out. Plus, it depends on how comfortable you are or your preference on your look. Kung gusto mong clean look, syempre mas madalas ang shaving, maybe every 2 or 3 days. So it depends then on your race. Like kung mga Caucasians, baka more frequent than us.
Oo, yeah. Ang shaving though, you're using a razor, mas makakanik. Or parang minsan mabilis masugatan din eh. So kailangan careful.
Careful.
I prefer waxing. I think it's parang mas less yung trauma for the skin. But just the same, both kailangan clean skin. Sabihin, make sure na nagsabon ka muna dun sa face, kung dito yon sa face or sa legs before you start shaving, para kung masugatan, yung bacteria will not be heading dun sa sugat kaagad. And after you do that, to moisturize also the skin kasi medyo nagda-dry rin as you shave. Ganon. Okay, so teenager na ba yung mga anak mo? Ako, teenager na yung...
Not yet, 7. My eldest is 7. Youngest is 2.
At least you know when they're na. Kasi I think for nowadays, it's important to address yung sexual growth. No? It's cool. Parang yun yung topic nung kid ko that they have to ask on what body changes happen.
Yes. And better for us to educate them instead of them asking their friends who also don't know how, or go through internet sites, the websites that are not reputable. Kaya medyo mag-change yung culture natin to address the needs of the adolescents now.
Yeah, I agree. Okay, so for those who want to check on an adolescent medicine doctor, you can go to Dr. Vanessa Ticzon. Vance, where's your clinic?
I have a clinic in PGHF MAB, Qualimed, and also in Manila Doctors Hospital and Diliman Doctors Hospital in Quezon City.
Okay, yan. Thank you very much at marami pang magiging adolescent medicine doctors coming soon, I'm sure. So thank you so much for being with us. We learned a lot. And
You're
I think it was good.
welcome.
Okay, thanks, Van. Salamat.
Thank you.
So thank you for watching Hashtag Hope Series. If you enjoyed this episode, please feel free to share it with others, post about it in social media, or leave a rating and review below. So to catch all the latest from Skincare for Hope, you can follow us on Facebook and Instagram at Skincare for Hope or visit our website, skincareforhope.com. Our next topic is on sensitive skin and eczema health. And we have a very special guest, a good friend of mine, a board certified dermatologist, Dr. Gail Robredo Vitas. So feel free to send us a message on your eczema skin questions in advance so we can answer them on our next video. So thanks again, and we'll see you next time.